Hello, my name is Will Martindale, and I will be presenting on the opioid crisis in Canada. 7 years ago, British Columbia declared opioid overdoses and deaths a public health emergency, and Canada's Minister of Health replaced the national anti-drug strategy with a more harm reduction focused strategy, the Canadian Drugs and Substances Strategy. Since then, roughly 35,000 Canadians lost their lives to an opioid overdose. In 2016, there were about 2,861 opioid-related deaths, an average of just under 8 Canadians every day. From January to September 2022, there have been about 5,360 opioid-related deaths in Canada, or about 19.5 Canadians every day, 87% of which occurred in Alberta, British Columbia, or Ontario. Since the formal declaration of an opioid crisis in British Columbia and the change to the Canadian Drugs and Substances Strategy, a few things have become clear. Canada's opioid crisis does not appear to be going anywhere anytime soon, and current trends suggest the crisis will likely get worse before it gets better. It is no question that the opioid crisis has gotten the attention of federal and provincial governments. In 2023, the federal government allocated $359 million over 5 years in funding to combat the opioid crisis, bringing the total federal funding to directly combat the opioid crisis to over $1 billion since 2017. Over the past 7 years, the opioid crisis has been extensively researched in Canada and North America, and as a result, we can now critically review the Canadian government's response to the crisis. In this presentation, I'm going to discuss how the opioid crisis is affecting Canada's economy, where the government funding targeted to combat the opioid crisis is going, and if the funding is effective. Unsurprisingly, the opioid crisis is an economic burden on Canada's economy. But how can we quantify the economic burden of a complex social issue like the opioid crisis? The economic costs of the opioid crisis can be categorized into 3 buckets: healthcare costs, loss in productivity, and law enforcement and the criminal justice system. According to the Canadian Substance Use Costs and Harms Report, prepared by the Canadian Centre on Substance Use and Addiction, in 2020, the estimated cost of substance use in Canada was over $49 billion, which equates to a substantial $1,411 per Canadian, and led to the deaths of over 200 Canadians every day. In 2020, opioids ranked as third in substance use costs behind only alcohol and tobacco. Combined, alcohol and tobacco consisted of over 62% of the total substance use costs. Opioid substance use cost Canadians an estimated $7.1 billion in 2020, or 14.4% of total substance use costs. This is the most opioids have cost Canadians between the years 2007 and 2020. Further, over twice as many people in Canada died of opioid use in 2020 than in 2007, indicating opioid use and costs are only increasing. In terms of healthcare costs, which include things like inpatient hospitalizations, day surgery, emergency department visits, paramedic services, physician time, and prescription drugs, opioid ranked third again and cost the healthcare system $519 million in 2020, or 3.9% of the total healthcare system costs brought on by substance abuse. Between 2007 and 2020, opioids increased in cost by 15.1%, further increasing the costs of opioids on the healthcare system. As for criminal justice costs, which include costs associated with policing, courts, and correctional services, opioids again ranked third in substance use costs, costing $1.1 billion in 2020, or 11.3% of the total criminal justice costs. Further, the criminal justice cost for opioids was the second fastest growing substance, increasing by 24.1% from 2007 to 2020. Finally, the last category includes losses in productivity attributed to substance abuse. Losses in productivity for all substances cost Canadians an estimated $22.4 billion in 2020, making it the most costly category. Loss in productivity included lost value of work due to premature death, long-term disability, and short-term disability such as absenteeism. Consistent with the other categories, the opioid-related numbers are not pretty. Opioids had the largest increase in per-person loss productivity costs, doubling from 69 per person in 2007 to 139 per person in 2020. So while opioids were not the most costly substance in 2020, it is the fastest growing substance in terms of productivity loss cost. Further, it is important to note that opioids rank third in most deaths caused by substance abuse, but lead all substances in the total number of potential years of productive life lost, which is calculated based on the number of deaths occurring up to 65 years of age. This is mainly due to the relatively young age of the average age of opioid-related deaths. Another thing to consider is that between 2016 and 2021, more than two-thirds of Canadians that died to opioid overdoses were employed within 5 years before their death. This statistic contradicts the stigma that opioid users were always unproductive members of society. Now that we have an idea of how costly the opioid crisis is and where the opioid crisis is trending in terms of cost, I'll now examine where the Canadian federal government funding is being used to combat the opioid crisis and how much funding is being allocated to combat the crisis. Like other public health matters, the federal government has a role in distributing federal funding to provinces. However, unlike our healthcare system, which receives about 22% of federal funding through the Canadian Health Transfer, the majority of funding allocated towards combating the opioid crisis is federal. As previously mentioned, the federal government has spent over $1 billion to combat the opioid crisis since 2017, including committing $359 million of funding over the next 5 years, which was announced in 2023. Further, since the adoption of the Canadian Drugs and Substances Strategy, the federal government has taken a more harm reduction-centric approach. As a result, most of the funding is mainly used to fund community organizations that provide harm reductions such as drug checking services, opioid agonist therapy, and spreading awareness and increasing education on opioid overdoses. In 2023, there is $134.2 million in funding put towards active projects, as well as an additional $93.8 million for programs that address substances in general. Unlike the Canadian Health Transfer, which is allocated on an equal per capita basis between provinces, funding used to combat opioids is unequally distributed to provinces. For example, British Columbia is receiving about 1/3 of all funding for active programs combating opioids or other substances. A research paper by Carol Strike and Tara Watson lists the main drivers of the opioid epidemic as the increased presence of fentanyl, overprescription of opioid medications, and the criminalization of drugs, which leads to fear of police and arrest that incentivizes people to not call 911 during an overdose and to do drugs in less safe ways. Are Canada's harm reduction services effective in stemming these drivers? It is important to note that the opioid harm reduction services are so new and slow to scale up that there is a dearth of information regarding their effectiveness. The aforementioned harm reduction services have promising evidence that supports the effectiveness of these services to prevent overdoses and deaths. For example, drug checking services using testing methods to confirm the purity of opioids, considering how in recent times the illegal drug supply, including opioids, has become increasingly adulterated with impurities, drug checking sites should be an effective harm reduction method in reducing overdoses. However, this method is limited as the range and level of detectable substances varies greatly among locations, as there is no standard drug checking method employed just yet. Opioid agonist treatments involve providing opioid users with opioid agonists such as methadone with the goal of preventing withdrawal and reducing opioid cravings. In a study consisting of over 3,800 participants, the rate of mortality of any kind during opioid agonist therapy was less than half the rate of mortality of those out of opioid agonist therapy. Further, the rate of mortality of any kind was 6 times higher in the 4 weeks after stopping opioid agonist therapy. This suggests that opioid agonist therapies are effective in reducing overdose deaths. The study also points out that the access to opioid agonist therapy and coverage remains low. And as I previously mentioned, loss in productivity is the most costly category of costs originating from substance abuse. And in 2020, opioids cost Canada an estimated $7.1 billion in lost productivity. By reducing deaths, especially deaths of younger users, which is common in opioid deaths, harm reduction strategies can in theory reduce productivity losses provided opioid users become productive again. In conclusion, the opioid crisis in Canada has continued to worsen since BC declared a public health emergency in 2016. And indicators such as increased deaths and costs due to opioid abuse suggest the crisis will get worse before it gets better. And while harm reduction is an effective tool in alleviating some of the effects of the opioid epidemic, it does not address the drivers of the crisis. Without policy changes that directly affect these drivers, such as decriminalization of opioids, which would reduce the stigma surrounding opioid use, make users not fear police, and incentivize users to get the help they need, the opioid crisis in Canada will not be overcome.